As India edges closer to the grim 1 crore mark as far as the COVID cases go in the country, the big question, of course, is that how is India gearing up for the vaccine? The centre has said that they have already made arrangements for the supply of vaccine to states as well, even as the regulators are yet to give a go-ahead to the vaccines and they've sought for more data. But how is the entire process really going to work? How far are we from getting a COVID shot? And what will be the side effects of the vaccine? And should you get a shot in the arm? So we decided to have a word with Mrinal Sircar of Dr. Mrinal Sircar of Fortis Hospital to understand some of these frequently asked questions. Listen in.
I think the vaccines are already here, and more and more vaccines will eventually get approved across the world, and the usage will depend on availability first of all, and practical details as to some vaccines would require very low temperatures to store and to move them from one place to the other, which may be impractical in certain parts of the world. Whereas others will be more easy to handle. So then, of course, the cost of the vaccine. So these three things will decide more or less what vaccine gets used where.
Right. So, sir, not talking about which vaccine gets approved in India or when it essentially comes, but, we are a large population compared to any other in the world, and probably we need, the number of vaccines that would really be higher. Do you think that more than the number of vaccine, it will be also a challenge, a logistical issue, a medical challenge, because not so many people are equipped to give vaccine. I mean, you cannot take vaccine from anyone. You have to be trained to give a vaccine. So all of those issues will be very, very important once even the vaccine is approved or it's procured from some of the pharma companies?
Yes, a vaccination across the population will be very, very challenging in a large country like ours with diverse population and huge numbers of people to be vaccinated. However, our healthcare system has been doing vaccinations very successfully for other diseases. And so certain amount of infrastructure would be in place. And I'm sure for a COVID situation, which is extraordinary measures will have to be taken. A little bit of noise that we are hearing through the media. Of course, I'm not the one with an insider information. They're going to use the election machinery, which is very effective because even in the remotest corner of the country, people are able to vote. On a similar mechanism, there are plans afoot to move vaccines to the remotest corner. That's the ultimate goal, I guess. But initially, when the number of vaccines will be more limited, I think that they'll be more targeted. So the vulnerable population, the frontline population, the healthcare workers, those above 60, those below 60 or below 50 with comorbid conditions, they would be targeted. So I think that will be even more challenging because identifying the right people who need and then delivering the vaccine will be challenging, of course. I think so. No matter how wonderful any planning is on paper, when you start executing, there will be a lot of nitty-gritties to be sorted out on the ground. So I'm sure a wonderful plan would be in place, but when it starts getting executed, further tweaking on the plan and further corrections would be needed as the program goes on. So yes, initially it will be a challenge. There would be different kind of challenges also. I guess there will be certain amount of vaccine hesitancy. A lot of people might feel that, why me? Let me wait and see what happens to the others. Let others get the vaccine first. That could be one scenario. On the other hand, particularly the healthcare sector, everybody may be wanting it first because we are the most vulnerable. So both forces might be in action. So yes, initial days will be challenging, but challenges are there to be faced and challenges are there to be fought.
Right, absolutely. So also, just wanted to get a sense that, a lot of people are worried that, why I should get vaccinated, we'll wait and watch for the next 6 months. But over the next 6 months, or from the time you get the first vaccine in India, from there to 6 to 12 months, there will be a lot of data to prove in who should take vaccine, who should not, whether people with blood pressure, sugar should use this vaccine or not. So, as things go by, multiple vaccine approvals, multiple approach towards vaccine, multiple approach towards different kinds of patients being given vaccine, all of that will come in, which has happened earlier as well with other pandemics.
I am sure, because even with the therapeutics or management issues of COVID, the information deluge has been there, and we have course corrected or modified our way we are treating our patients all along, and more information keeps coming in every day. Same would very likely happen with vaccines, and normally this kind of vaccination would have taken years to develop, with all the hard data being collected before being rolled out. In an emergency situation, do and die situation, the information is lagging behind. So whatever information we have, whatever scientific data we have, the vaccinations programs are being rolled across the world, because lives are at stake. So chances are things will improve with time. We get even better vaccines. We might even get some combination studies coming in of different kind of vaccines, or even existing vaccines being improved for special groups like the elderly by adding adjuvants, so their immunogenicity is better. Many things are likely. As far as the safety is concerned, I think all the existing study data which is coming out in the press, is safety in terms of immediate safety are very high. Otherwise, no regulatory body would approve such vaccines. Whether what happens over next 20, 30, 40 years, that data can only come in next 20, 30, 40 years.